So, eczema. Most of the time when you see an infant child or a toddler, the eczema most commonly breaks out right at the wrist, right there where those little chubby wrists are and the elbows, and right as it goes onto the hand, you'll see this area. They'll usually scratch until it's raw. Okay? You'll very commonly see it also down on the ankles as it comes out onto those little chubby feet. And you'll see it here again, and they'll itch those things raw. You'll put stockings on them, they'll tape stockings on their hands, try to tape stockings on their hands and feet at night, and they'll just tear them off and just scratch. Now, if you've seen eczema in a toddler like that, you know what I'm talking about, and it is miserable. Okay? If any of you ever seen that, it's a tough situation. And what we find is babies being introduced too soon to some of these fruits and some of these foods that are creating for them food allergies. Okay, go ahead.
I think they're even talking, I've been reading that introducing wheat, like bread, the first year or two can cause that allergy.
Correct. These are the ones that we see most commonly. And then when we look at eczema in adults, or once they've passed the toddler stage, then the eczema that we see most often in the adults will go from this area more toward the elbows, and then you'll see it on the backs of the elbows. And now we're not dealing with as much eczema as we're dealing with an autoimmune condition called psoriasis. Okay? You've seen psoriasis commonly on the elbows, commonly on the knees, and also on the scalp. That's the areas that will affect the adults. So we just jumped several generations and we start to look more for psoriasis as an autoimmunity. Okay? When we see this, then we're often looking more at the grains as the irritant. Okay? So in this case, wheat, rye, barley, oats, corn, and soy. And that's what we really look for there. Okay? So again, several different presentations, and again from newborn to toddler just by looking at the skin. Okay, kind of fascinating. Now, what do we often see also then with the prepubescent child as far as a skin affliction? Usually is the dry, very, very dry skin and the dry and cracking skin. Again, may be confused as eczema, but more often is a condition where we'll see cracks and a seasonal cracking. Like we live in a cold environment right now. My hands will get real dry in this time of year, but I wash my hands between every person during the day as well, and so my hands get dry. But what we notice a lot is the liver is dependent on certain essential fatty acids, and one of the most important essential fatty acids for maintaining the integrity of the skin is gamma-linoleic acid, GLA, which is found in high concentrations in borage oil, borage seed oil. Okay? And we've had really, really good results with a brand called Progena. Progena makes a borage seed oil. Commonly for children under 5, we'll give them, actually children under 12, we typically give them 300 milligrams of GLA once a day. And for the little people, even with this, will help to increase their skin barrier. And it comes in a little gel cap. You just pierce it with a pin, express out that gel, and then they just take it orally or put it on some applesauce. It's really easy to take. In the adults, we'll do that 300 milligrams twice a day. Progena actually makes one now that has almost 1,000 milligrams per gel cap, and I'm really happy with that one. And this year, my hands really get cracked when I'm washing my hands and it gets cold like it is now. And usually I'll have some really bad cracks, but I've been doing actually 2,000 milligrams a day, and it's been very helpful for me this winter. So gamma-linoleic acid in borage seed oil is an essential fatty acid, which means we don't produce it. We have to take it orally. We have to supplement with that. So if you're noticing that your hands are cracking easily in the cold, if you notice that your child's hands are cracking easily with the cold, or if you notice that the eczema also has that kind of a response, eliminate those foods and use the borage seed oil with them. Now another thing that you always want to look for with eczema, remember when we were young and you used to go to school and get those scratch and sniff stickers? Remember it smelled like the different smells? Maybe some of you didn't ever smell those because some of them were pretty gross. But when you scratch and sniff eczema, what does it smell like? It smells like yeast. Okay? So if it smells like yeast, treat it as a yeast infection. Okay? In the infant, we'll use gentian violet. Remember, yeast infections orally or thrush. So if you have yeast on the bottom, make sure you've checked also mom, and also then check baby's mouth for a condition called thrush. And something that's very, very helpful is something called gentian violet. And gentian violet will actually do just that. It's violet, okay? And that will actually turn the mouth purple. You can use it orally, put a little on the tongue or on the finger and just blot it onto the roof of the mouth, and that gets rid of that. Or actually express it directly on the mother when she's nursing, and it can transfer into the baby's mouth. Okay, but it works very well. So gentian violet for thrush, and then can also be used topically if you have a thrush smell to the skin topical as well. Okay, a couple other things that we've found very effective with eczema in adults when it is a yeast infection is something called candicidal. And when you look at candicidal, has caprylic acid in it. And caprylic acid is an extract of coconut, which is actually very good at treating yeast as well. Okay, so yeast infections are very common on the skin, especially in the diabetic. There are big rashes under the armpits. You get big rashes in the groin area and along the skin folds. Very, very common with a person with diabetes. And again, will have a very strong yeast smell with it. When the body cannot process sugars quickly enough, it allows yeast to proliferate to control that blood sugar. Remember when we used to make homemade breads and you'd add yeast? What do you add to the yeast in the warm water? Sugar, exactly. And the body naturally will allow then this concomitant infection of a yeast to help to digest or break down those sugars that are proliferating or overabundant in the system. All right. So a lot of people with the more severe diabetic cases, they'll just even when they walk by you, you'll smell that real strong yeasty smell, almost a brewer's yeast smell. Have you ever noticed that? Anybody? If you just observe, I guess I probably see more cases like that when people will come in and just as soon as they sit down, there's this strong smell, and it's very consistent with that, and it's a diabetic smell. Okay? Now, let's go then to one other skin condition or affliction that I think is important for us to address tonight. Everybody okay to that point? Okay. Let's erase this as well. Now when we talk about the skin again, the skin has such a great window into the rest of the body. And when we look at it correctly, it can actually help us to diagnose or predict other areas where there may be something going on that we may be missing otherwise. Okay? So when we look at the body, really quickly, we can actually see several things that may help us to determine or decipher other areas to look at specifically or specific regions to look in the body. When we see acne, especially along the jawline, this area is most often associated with hormonal acne. Okay? Little dots across the forehead we find to be very consistent with stress. This area across the bridge of the nose has to do with two things. One, I've found it most consistent to be a dairy sensitivity, and also may have to do with breathing difficulty, so actually congestion, which goes right along with dairy. If a person has a dairy sensitivity, they produce a lot of phlegm and a lot of mucus, so they tend to be mouth breathers because there's a lot of swelling or inflammation in the nasal area. When we look at this area again, the very end of the nose has to do with the prostate in the male, whereas this area directly under the nose has to do with the cervix in the female. This area around the mouth basically follows the pattern of the gut. So if you're to take the mouth, and we look at the mouth this way, and we have the lips coming this way, what we actually find is that the mouth itself is a reflection of an overlap or overlay of the GI system. So we actually can place, in essence, the colon directly over the mouth this way, which gives us then a potential indication of where potential problems are in the GI system. For example, how many of you have seen people that continually get cold sores on the left side of their mouth? Okay? Or they get this little cold sore right up in this area. Or they'll get this cold sore right up in this area. Okay? So you can see quickly when a person has these cold sores that basically this is the junction between the small intestine and the large intestine. This is called the ileocecal valve. This is the appendix. Bless you. And then that has the right ascending colon, the transverse colon, the descending colon, and then we have over on this side what's called the valve of Houston. And then it goes into the sigmoid colon, and then descends out through the rectum and the anus. So when you actually look at this, here's the up